Thank you. President, CEO of Compassion and Choices, and as we know, a huge supporter of the legislation as well as this work across the country. Thank you for your work.
So thank you so much for having us here today and giving us a chance to share with you what we've seen with the implementation in California, but also across all of the 10 authorized jurisdictions. But before I do that, I just want to take a moment to really thank and acknowledge all of you on behalf of our supporters and so many other terminally ill Americans. We are so fortunate to have the leadership of Assembly Eggman, of Senator Monning, and of Senator Walk, and you have really made the lives of terminally ill Americans so much better. So thank you. Yes. Compassion and Choices has been involved in the implementation of the California End of Life Option Act and also have worked across all of the authorized jurisdictions and wanted to share the evidence and the data from across all of those places. But before I do that, I wanted to just put this law in context. And it sounds like each of you have had the experience to talk with somebody who's been terminally ill. And I, in my job, am fortunate that I get to have that experience on a regular basis. There was one woman that I had a conversation with from Half Moon Bay, and she had pancreatic cancer. And it was taking her life, and her experience was so devastating. And she was so courageous and brave in sharing that experience with me. And then all of a sudden, her entire demeanor changed, and she talked about the moment that she received the prescription. And she said, "This was my prescription for peace of mind. It was a gift to me." And that is what this law is about and why it has made such a profound difference on the lives of so many people. So thank you. We know from a combined 40 years of experience across 10 authorized jurisdictions that there has been no negative unintended consequences as a result of this law. There has not been a single incidence of proven abuse, misuse, or coercion. That's been the experience in California, and it has been the experience in every other authorized jurisdiction. We also know from studies, the Journal of Medical Ethics report concluded that assisted dying did not pose any heightened risks for any population, including vulnerable populations. What we heard from the California data, which is consistent across all of the states, is that very few people will choose to use the law, but huge percentages have gotten tremendous peace of mind from simply knowing the law exists. We have seen research studies that have come out that have demonstrated that as a result of the implementation of medical aid in dying, there was a Journal of Palliative Medicine study, that it has resulted in more candid conversations between doctors and patients, higher hospice usage rates, and improved palliative care training for physicians. And here in California, the physicians of California have reported several very similar positive benefits as a result of the law. So the good news is we have a tremendous amount to feel good about. There's no negative consequences, and there have been improvements both for the individual dying person and also to all of end-of-life care in California. Unfortunately, there is room for improvement, which of course is the case anytime that you pass a law. And what I'd like to do today is share a little bit about those areas.
And Kim, if I could interrupt you just one
yes.
second. And greetings to Assemblymember Fraser, who has joined us, who is also a co-author on this bill, who has been a consistent member of the Select Committee on End-of-Life Issues. Do you want to make any remarks, Jim?
Thank you, Madam Chair. I just want to thank everybody involved in this process. It's been a long road to get here, and understanding that dignity and self-esteem for not only the individual, but the ability for the family to be supportive is just so essential. And my hat's off to each and every one of you in the chamber today, thanking you for your support, because we've all run up against this issue, and our families and loved ones and just human beings deserve this kind of dignity. So thank you.
Thank you.
And thank you, Assemblyman Fraser. In terms of the sort of broad overstrokes, is that the law is working to protect patients, but that there are just too many regulatory requirements. It's about a 13-step process for somebody to get through. And people are unfortunately dying trying to get through the process and never achieving that peace of mind that they're seeking. We've seen really, there's a ton of different challenges with the law. There are three that keep emerging as the top things to consider addressing in future legislation. The first is the 15-day waiting period. There was a study that came out from Southern Kaiser that showed that at least a third of people were dying during that 15-day waiting period. Kaiser Southern is a supportive institution that has patient navigators. A lot of people are starting out in unsupportive systems or somebody that's more fragmented. So the number is actually far higher than the 30% that their study showed. There are other states that are addressing this with some innovative legislation. Oregon just passed a law last session that makes it so that doctors are allowed to waive the 15-day waiting period if somebody is imminently going to die. There are also two states, New York and Minnesota, that are actually eliminating the waiting period, recognizing that what you're doing with a 15-day waiting period is asking somebody to suffer for 15 more days. And it really has not proven to have any positive benefits to it. The second big challenge is that patients are having a really difficult time finding two doctors to participate. And there's a host of reasons for this. One of the top ones that reasons is that, as you know, there's an opt-out provision for health systems. So health systems are allowed to allow all of their doctors to not be allowed to participate. As a result of that, there was a study that was published in JAMA that showed that 97% of all religious institutions don't allow participation and 35% of secular hospitals. So that really narrows the number of doctors that are potentially eligible to participate down. So that's one of the things, and then some of the paperwork that is involved, really teaching doctors how to do that also presents a barrier as well when they don't have to do that same thing for other end-of-life options. There are three different things that states are looking at to address this. New Mexico has a really innovative provision that was in their last legislation that allows a person who is already on hospice care to only have to get one additional certification. So they've met the certification of having that 6-month eligibility criteria. They only need to find one other doctor. That doctor would be the prescribing doctor. There are 5 states that are right now advancing legislation that would extend the privileges so that APRNs and physician assistants are allowed to prescribe. So there's 5 states doing that. That's legislation is currently advancing through Hawaii this session. They've made it the farthest. And then there are some states that have less reporting requirements than what is here in California. Both Vermont and Colorado do, and of course Montana has none because it's through the courts. The third big challenge that we see with the law is that there is a lack of transparency in the practice. Sometimes patients are not getting complete information from their healthcare providers. You'll hear some stories about that later today. Other doctors who object to the practice are refusing patients or refusing to even refer to another practice, and some are even holding medical records hostage. That is just crazy. In Delaware, they have a provision in their bill that would allow healthcare facilities that opt out of the practice to implement not to be able to implement gag orders on their doctors to silence them. And then there is pending Washington state legislation that would require hospitals to report their policies to the Department of Health, so the Department of Health can publish them, and that would then allow patients to be able to select their facilities based on those that are supportive of their values and priorities. They're only doing hospitals, but what would be really innovative is if you did hospices as well. So those are the sort of 3 big things that we see. As you can see, we're not recommending the expansion of the eligibility criteria or removing any of the core safeguards. We're really just looking for very practical ways that we can address some of the challenges so that you meet the original intention of the law better. I'm going to end with perhaps my most important message of the day, which is really one of gratitude. Without question, the California End-of-Life Option Act has resulted in a more compassionate end-of-life experience, both for those who've chosen to take the option, but also for everybody else. In addition, since California implemented this law, 5 other states have passed very similar legislation. And we know from our experience that California is such a robust and large and diverse state. Taking this, implementing this legislation was one of the reasons that gave those lawmakers comfort. So on behalf of not just our California supporters, but our supporters nationwide, I'd like to express our thanks. Thank you so much.
Thank you very much. Thank you very much. Yeah, I think some of the things that you mentioned are my office, and I'm sure Senator Monning's office or others get a lot of calls. And my chief of staff spent probably an hour on the phone with somebody Christmas Eve, who was at that, trying to find that second physician and knowing that it was going to now be after the new year before anything could happen. So we have certainly heard those stories. And seemingly, and I'll be interested to hear what we hear from health systems, differences across the state has been also of interest to us. And so we know at some point we have to come back and revisit, and we have a sunset coming up, and at that point perhaps some changes will be made. But we've all been very resistant to open this back up for changes until we're very sure of the data of what would be the most compassionate way of going forward. And we certainly appreciate all the support from Compassionate Choices, really serving as a hub for families in need. Senator Wolf? No. Sorry, Mommy.
Thank you. Well, I want to thank you for your testimony, and more importantly than your testimony today, the work you're doing every day nationally. And I just wanted to follow up on the Oregon amendment on the 15-day waiting period. It's now discretionary with the attending physician if he or she determines that that 15-day wait would be onerous. They have the authority. And then I think you mentioned a couple of other states that are also not requiring the 15 days.
There's 2 states that have legislation pending, New York and I think it's Minnesota, that would eliminate it, but it's not passed yet.
Okay. But those also might provide a model of how people are approaching it legislatively. Because certainly we have heard in our offices and at the hearing that the chair hosted last year, that was the testimony. There was no evidence of coercion, of bad outcomes. All of the focus was people who were, the impediment was the 15 days. So I think that's certainly going to be on our radar for any future. In the legal arena, you didn't really address this, but we've faced challenges in California. The Attorney General defends California's law and has been doing a great job of doing that. What's the status of any other legal challenges nationally or others pending in California?
So in California, just for, I'm sure you know, but for those who don't know, the case in the district court just found that the law was passed constitutionally and that the opposition did not have standing to bring all the other claims forward. Our understanding is that today that court case is supposed to, the opposition is supposed to file an amended complaint at the district court level. It's unclear what that amended complaint will say, but that's supposed to happen today. And if it happens at some point while we're here, we'll let you know. In terms of national lawsuits, there is a lawsuit in New Jersey. A doctor is claiming he doesn't want to have to make referrals or hand over medical records, and that even that is a violation of his constitutional right, and that the law as passed should not be valid or legal. So that's making its way through the courts as well in New Jersey. Those are the only 2 states that have this specifically challenged. The bigger thing that's taking place, with which the California Attorney General has been very involved in, is the HHS Office of Civil Rights. And that office, the regulations that came out on it really give a tremendous amount of weight to a doctor's ability to, and doctors, nurses, healthcare providers, anyone who accesses the patient, their ability to opt out of participating. It's to the point, the way they're written, where a person, a secretary, could choose not to turn over the prescription and not tell anyone that that's what they've done. So fortunately, the California Attorney General has been a leader in trying to make sure that law does not, those regulations don't get implemented. But you're seeing that shift taking place nationally, and that's something we're really paying attention to and trying to avoid.
Good. Well, thank you for that update. And I do want to just, on the record, acknowledge the support of Governor Newsom's office and Attorney General Javier Becerra, who have been representing the state in defending the laws. And I know Compassion and Choices has as well. So thank you. Thank you, Madam Chair.
Kim, thank you very much for all the energy and effort that CNC has done, not only in our state, but nationally. I wanted to talk a little bit about the different systems and whether in any of the other 10 state experiences, there is any kind of more than encouragement, but mandate to refer or tell about the law. We don't have that in ours, and we deliberately left it out because there was concern about that on on the professionals' parts, and the institutions. But I'm wondering whether there's been any progress in this area.
There are not, all of the states have the same opt-out.
The same opt-out.
The same opt-out, yeah. Okay. The challenge with a mandatory, well, I think you could probably do a mandatory referral, maybe to a government website.
Yes.
That's exactly the challenge, the balance that we're seeing around religious freedom versus patient autonomy, and that's being challenged all the way up to the Supreme Court. And so figuring out how you navigate that, I'm really hopeful that that might be something that California would be willing to take on. Obviously, you have an attorney general who feels really strongly that patients should have a voice, and that a doctor's doctors can opt out, should not override a patient's need for information. So it would be great to look at some innovative ways to do that. Delaware probably comes the closest with the provision they have in their bill, but no one has authorized legislation that has really addressed the issue.
I've noticed that over the last few years, CNC has spent a great deal of effort talking about Alzheimer's and Parkinson's. And I'm curious as to where your organization is at this point with the 10 states and that issue.
Sure.
And that is, incidentally, when people come and talk to me about this, Bill,
Sure.
that is the major issue that seniors bring up all the time.
Yeah.
Dementia and Alzheimer's.
Yeah.
So we
And
separate out medical aid in dying from how to address Alzheimer's and dementia. As you know from passing this law, the core safeguards that are a part of medical aid in dying is that the person has to be mentally capable and able to self-ingest the medication. And if you imagine, given the inequities that we have within our healthcare system, the experience that we might have if we were to extend that to somebody who's not mentally capable. You look at the countries that are doing that, and they have entirely different economic and healthcare systems. But that doesn't mean that we should allow people with dementia to die. And there are actually legal existing options right now that right now we're keeping people alive for decades beyond the years at which they could experience a natural death because we keep extending their life using medicine. And people are allowed right now to pre-claim their voice. We just put together a tool that allows a person to go onto their website, so I encourage you to give it to any of your constituents. It's free. They can document the point at which they would want to forego treatments, and that would allow them to realize a natural death, and it will cut years off of their life. You know, it's things like don't give somebody the antibiotic if they get pneumonia, or if they have heart problems, you don't have to keep giving them the heart medication. So there's all kinds of ways that we can shorten the length of time someone suffers with dementia. We do imagine that at some point you're going to have the same implementation problem with that you have with medical aid in dying. It's completely legal, but getting a system to support you will be a challenge. So we would like to, at some point, bring forward legislation that protects doctors, that makes it so that health systems feel more comfortable honoring patients' wishes. And so that's not something we've done yet, but something that we'll do in the next couple of years.
Thank you. Thank you.
Can you talk a little bit, is it implemented or suggested legislation in New Mexico about if you're in hospice that then you can forego the 15 days or the two referrals?
It was suggested legislation last legislative cycle. They do not have a bill advancing this time because they're in a budget year. And interestingly, it did not, that was not one of the provisions that got pushed back. They didn't pass the legislation, but it wasn't because of that.
And as an organization, have you taken a position on?
We support it, yeah.
Okay. Okay. And is it fairly consistent across the country, the same opting out of physicians, the same level as we have in California? And
Yeah. Unfortunately, it's the same thing, and it's challenging because, doctors do have the right to be able to opt out. I believe that, and I don't know what California's laws around this, but I do think that APRNs will transform this practice. So Hawaii is the first state that's really, I think they have a good shot of passing it this legislative session. And nurses are about curing. They're not about about healing and prolonging. And so they really understand the experience of a dying person at the end of life and know how to sit bedside with them and how to support them and see their values. So I don't know what California's laws and whether that's anything that would ever fly here, but APRNs are, no, not in California.
yeah.
Oh, well.
Yes, I don't see wings here in
All right,
California
no wings here.
for that to fly. Yet.
Yet.
Yeah. Okay. Any, Senator Fraser? No? Okay. Again, thank you for all that you do and all that you'll continue to do.
Thank you.
And we all continue to use you as a resource and respect and thank you for your work.
Thank you.